So I've spent a lot of time on this point, and this is very related to the plan because it lays a foundation, a baseline for why do we use this plan. And I hope that this makes sense. Bottom line, we can continue. We have the opportunity to continue doing exactly what we've always done, promoting paid fitness events or recreational opportunities where people have to leave their community to go to someplace else to recreate. We can continue to do 1 time a week physical education. We can continue to do the exact same fill in the blank that we've done for years, and we're going to get the same results, if not worse, because our society is not, regrettably speaking, our society is not embracing this as a norm currently. So we need to change the way we do business, and basically, bottom line, that means to create more opportunities for people to be physically active through policy and environmental change, supporting them with the environments that they live in at an organizational level and at a community level and beyond. So that's the paradigm, that's the mindset that this plan was built around. Let's take a look at some of the actual sectors and some of the things that are recommended here. So for example, and I'll just hit a couple of these. Within any given sector, that being mass media would be the sector here in this example, there are policy strategies. There are multiple policy strategies, and each of the policy strategies have tactics that are associated with them. So it's a basic work plan of sorts. So you've got the broader heading that's a sector, you've got the policy strategies that are within that sector, and then tactics individually supporting any given strategy. Follow that delineation? Okay. So, thinking about mass media, one example would be enacting federal legislation to support a sustained physical activity mass media campaign. Big example, a lot of money included in this, but it would require basically a policy change to fund that issue. Some of you may remember the VERB campaign that took place several years ago. Great success, but also a hefty price tag. So that would be an example of a strategy, and some of the tactics that would be associated with that would be creating a task force, building advocacy for that sustained funding. So in essence, an action plan associated with those policy changes. Within public health, the example strategy would be to, for that group, that target group, would be to disseminate tools and resources that would help with these types of issues. And a tactic underneath that would be to support and expand, and I chose this personally, sorry about that, but a little promotion here, support and expand the National Society of Physical Activity Practitioners in Public Health. You'll hear me reference this group a couple of times. The bottom line, it's a national professional society. You may be familiar with the American College of Sports Medicine, which is a more clinical exercise type of oriented group. You may also be familiar with AFERD, or the Alliance for Athletics, Physical Education, Health Recreation. You know what I'm talking about. Sorry. Alliance for Athletics, Health, Physical Education, Recreation, and Dance. Sorry about that. So that's professional organization. 2 professional organizations. One more for the clinical exercise type folks. One for physical education type folks. And the PA Society is one for public health type folks, working to influence broad communities of people. So, an education strategy, develop and implement policies requiring school accountability for quality and quantity of physical education and physical activity. Again, a strategy and the tactics associated with that. One tactic would be to enact the Fit Kids Act. Healthcare, I'm probably not going to go into all of these strategies, but you see some of the point here. One strategy for healthcare, making physical activity a vital sign. A tactic associated with that, tracking patients' physical activity levels and electronic medical records. Again, those types of examples. Under volunteer or nonprofit sector, convening stakeholders. Basically the role of the nonprofit, organizing and promoting activities within a given community. And a tactic associated with that, promoting adopted strategy and approach. I'm not familiar with that particular approach. This is one that we mentioned a little bit earlier, transportation, particularly related to things like rural grounds. one strategy would be to change the way the US DOT does business. And a tactic associated with that, creating that complete, connected system of transportation options. Business and industry. These folks have the money, so it's important to engage them appropriately. Interacting with the other sectors to promote, and identifying legal organizations to interact. Parks and Recreation. Increasing your capacity, increasing your ability to provide resources. And a particular tactic, developing certification, continuing education programs for you. So once you've all been to conferences and things of that nature, and you see how plans get developed and they get released, and everybody walks out and they, look at here, I've got a plan. Then what do you do with it? Well, traditional step is, first thing you do is you carry it back to the office, like a bee, got it under your arm, right? You sit it proudly on the corner of your desk, not on any corner, you don't put it in the stack, you put it real prominently on the corner of your desk so that everybody in your office can say, you were there, you were there, you were there, I saw you there, that was important, saw you on TV. Eventually, you get tired of it being on that particular corner, you've got to put it on the shelf, and you proudly put it up there, and you stand back and watch. That was a good conference. That was a good conference. But then we leave it there. Traditional four-step approach to any new plan, and you have to pardon the irony, but this plan actually requires action. So, because this plan has been released, it was released in May of this year, we're now in the process of developing an implementation plan. What do we do with this document? It's actually, we're only, I refer to this as a document. It's more of a website and a web resource than it is an actual physical document. On the day of its public release, which was very strategically placed in downtown DC, there were only about 200, 250 physical documents ever made, public and printed documents. So you have as much access to this document as the rest of the nation, except for those few targeted congressmen and women that were available for that first release. So the implementation priorities, there are a number of them, but one of them is to create a cause marketing campaign. And Sheree, can you define a cause marketing campaign better than I can?
Well, it's a marketing campaign, it's a social marketing campaign. Trying to get people to adopt an idea as opposed to buy a product.
So the idea, going back to what you were, what you were saying earlier, ultimately we are trying to influence decision makers of all levels. That decision maker can be the legislator, that decision maker could be the individual behavior, the person we're trying to influence. But we're trying to sell this idea of increased physical activity at all levels. We are engaging in fundraising, trying to get more money to support this concept and promotion of it. They're developing a large national communications plan. Part of the reason for the fundraising, there's a lot of money that needs to go into that. Developing national policy priorities, and this is pretty big. We've listed a lot of policy issues in the national plan itself, but we've got to choose a place to start, because if you create a list of 200 possible policies, which are, I haven't counted them, there's probably quite easily that number in this plan, you've got to figure out where to start that process at, and which ones are the top priorities. So they're creating that priority list, looking at different implementation councils, and then ultimately they're going to be publishing, this month, they're publishing the implementation plan. So, the National Implementation Plan is being coordinated by an advocacy, even a lobbying group called the National Coalition for Promoting Physical Activity. Anybody heard of NCPPA? Bottom line, they're located on the Hill, and they are a lobbying group to promote these issues. They're taking all of the input, all of the priorities from the national plan and others, and they are working the Hill with these issues, to address the transportation policies, to all of the things that we've mentioned so far. But they're also serving as a coordinator for some of these other efforts. So while most of us don't have the opportunity or the legal or logistical opportunities to lobby, these folks are coordinating some of the other efforts. So the implementation plan, as mentioned before, is set to be published this month, to be promoted or released this month, and it essentially will outline some of the different priorities in each of the sectors. Each sector work group has identified some of the priority areas. Those are some of the more tangible results that can be worked through. Some of the work is extremely important, but it's going to take years to actually see come to fruition. So we need to get some momentum going here. You know how to steer a battleship? You've got to get it moving first, then you can change it. So trying to get some action, political action associated with this, and then we'll hone in on some of the bigger issues. Let me just very briefly describe that each sector has, they've got a leadership team associated with each sector. Each of those sectors have chosen key strategies within those sectors to focus in on, and they've associated leaders with those particular strategies. And then there are other folks who are not necessarily owning the implementation or the coordination of the implementation of a particular sector or a strategy, but are more general supporters in the area. So, for example, some of those organizations that are providing leadership in this capacity, the National Society of Physical Activity Practitioners, and they've also heard of Trust for America's Health. They're providing leadership in the public health arena. Under education, we've got NASP and NASP. So, if you're not familiar with that, they're basically two national groups that are very influential in the schools world. Under healthcare, American College of Sports Medicine, and the AMA, American Medical Association. Others in business and industry you've heard of before, and I won't read them all to you. But let's pause for just a second and take a look at that list. Ultimately, you've got very big players at the table who are leading this effort.